10 a.m., Radio Bandido.
The views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with Makati Med as we discuss the latest health and medical topics with doctors from Makati Med. For a healthier and uplifting lifestyle, tune into Healthline with Makati Med on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with Makati Med, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from Makati Med interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with Makati Med. I'm your host, Nicole Jacinto. And with us today on the program on Healthline with Makati Med is Dr. 𝗛𝗶𝗵𝗹𝗁. He is an otolaryngology specialist. So he's an ENT, folks, for those of us who know the, hello, doctor, the more common term ENT. So it's ears, nose, throat. Right, doctor?
Yes. Thank you again for having me on your show. Last time we had a quick talk then about, I think, many years.
Yes, many years disease. And thank you for being on that show, doctor, and for being on today as well. I hope you are safe where you are right now, in Metro Manila or in Makati Med. If you are in the hospital checking patients, thank you for doing that. In this weather. So just a word to those also watching and listening from abroad. Thank you for checking in on us here in the Philippines with the typhoons the typhoon that is just coming in and out. Indeed, it is a somber and serious time for us here, but thank you. And especially thanks to Ethan Ong of Singapore for reaching out and just checking on us. He was just checking if the people that he knew in the Philippines was okay. So I'd like to thank him for reaching out and doing that. And to those who were, a lot of people were devastated. And so whatever we can do, just share our blessings with others. It's time to count our blessings. And also for those who have experienced losses, pretty sure that people are there for you. And everyone else who cares. I hope you feel their care in one way or the other. Okay, so doctor, looking at today, we're talking about newborn hearing screening. Okay, so just a brief overview. What exactly is newborn hearing screening? I know there's screening for newborns, but I've never heard of newborn hearing screening actually. Can you just give us a brief overview before we get into the nitty-gritty?
So, before everything, did you know that this has been enacted into law since 2009? So there is such as a law. It's the Republic Act 9709, and it's entitled a universal newborn hearing screening, which also entails or kasama yung early detection, diagnosis, prevention, early diagnosis, and intervention of hearing loss sa children. So, basically what the program is and yung law is to detect yung hearing in children. Kasi if these children, these newborn babies do not develop hearing, do not have normal hearing, they will not develop normal speech. And they will not be able to. These have a lot of impacts. First is yung psychosocial, kasi they won't be able to communicate effectively. Next is yung socioeconomic. Yes. They will have a hard time also contributing to society and in their household, kasi they won't be able to have normal education. So iba. Medyo that's why this has been pushed in other countries. And again, thank you for the proponents here in the Philippines. And again, they pushed for it to be enacted into law back in 2009.
Thank you,
Yeah.
doctor. And you were saying like you asked us if we knew, and I did not know that it was a law. And thank you for teaching that today. And as you said thanks to the proponents. And yes, the things that you mentioned are very they are like the most relevant things. Well, first of all, the child and the parents' immediate family will suffer. There's a psychosocial component. They won't be able to communicate. Anyone who has hearing loss of some kind, or who doesn't develop normally like any other child would, it's hard to be, to live in a world where you cannot communicate, and then you are also having a hard time understanding people communicate with you. And as you said, of course, it affects speech and how fast speech may or may not develop in a child. And then you also said there's the socioeconomic component, which will make it difficult for the child to be able to contribute, or for even the people within the household that the child is living in to be able to to perhaps be able to express their, whether it's care or any other type of communication that's needed between the child and whoever else is surrounding the child in the household. And as the child grows, and as you said, if it's not a normal development, the child can be excluded out of so many things, including jobs, including other things when they get older. Okay,
Yes.
so doctor, thank you for letting for giving us that information, and from being you being an otolaryngologist or an ENT, it really gives it that authority that we need to take this seriously. And when it comes to the newborn hearing screenings, how when you say newborn, how newborn should the newborn be? I mean, or when does it usually occur, and when does the screening occur, and when does the law say it should occur? Is it mandatory? Is it an
Yes.
encouragement? Okay.
So what the law says that all newborns. So
Mhm.
again, for the audience, no, for everyone to be aware that all newborns should be tested
Mhm.
within ideally and 1 month.
Within 1 month.
Yeah. So detection screening should be by 1 month. We call it the 136 rule.
Mhm.
Screening should be done within a month, and by 3 months, dapat na-diagnose na if there is really hearing loss. And by the 6th month, intervention should be done,
All right.
which we will discuss in a while. So
You
different,
know.
ano yun, no? Yun. So ideally 1 month, and it encompasses everyone.
Mhm.
And in the law, it states that it can be refused by parents if they have religious beliefs or beliefs in general na ayaw nilang ipa-screen yung baby nila. But they have to have an undertaking or signed document na they don't want their baby to be screened.
All right. Okay, doctor. So there should be a document where it's the parents who refuse.
Yeah.
Okay. Because I was going to ask you, do you think that that is actually followed? Because even before this show, I do know of someone who I did not know about the law, but she discovered some hearing loss in her child when the child was older. And do you think that it's followed everywhere, or all over the country, or do you think that it's something that really needs to be promoted even amongst medical professionals and places where, even let's say the most common thing, of course, in the provinces is to have the government hospitals or health centers or lying in clinics, where what you call it, where people go to give birth and where children are born.
The work is in progress. No, I would like to believe so that this is being enforced widely. At a certain degree, yeah, hopefully 99%,
Mhm.
or yun nga lang eh, there's still a lot of work to be done.
Mhm.
Uh, and yes, in terms of, I usually ask my colleagues in the provinces, and then ano, it is enforced naman. And somehow, ang danger lang, it is a screening
Mhm.
test, and it is, of course, hindi siya 100%, but mataas yung chances of catching. Because there are some conditions, of course, that will not be able to be screened.
Right.
Very rare, but at least we can get the common ones.
Okay.
Yung fairly common, at least we'll be able to save or change a lot of lives
Yes.
by
Thank.
intervening early. Yeah.
Yeah.
And again,
Um.
a good example of promoting awareness and ano is me being invited by you guys. Thank you very much for being part of the advocacy of this awareness and making this law and idea of the screening be known to a lot of for our countrymen.
Thank you, Doctor. I hope the word gets out there and that the show serves as a platform to really, for it to be better known and for it to start for the law and the fact that there is newborn screening for hearing loss to be known and for it to start being talked about more and being spread, the word being spread more. And for people as they keep watching the show and clicking on episodes to understand these issues better and to start caring about them more, and as you said, many lives can be changed for the better, of course. Um, okay, you said it's a work in progress, as you said, the whole process, the whole awareness, and it's not 100% sure that you can actually detect some hearing loss, or at least the more you said the more common ones. Perhaps we should start with okay. So I asked you how newborn, like, or how old the baby should be, what you define as newborn when it comes to screening, to hearing loss screening, and ideally within a month, or by the time the baby is a month, the baby should be screened, and then what was it, 3 months,
Yeah,
another
3 months,
test.
meaning definitive yung diagnosis if the patient will be uh will have will have hearing loss or not. And by
Mhm.
6 months dapat may intervention na, meaning either non-surgical or yung part of counseling, and also kung may hearing aids pa na kailangan.
Yes.
So that's part of the treatment. And again, I explained that by 1 month yung screening, no, but now, if you were to ask babies born here in Metro Manila and in some of the provinces, they actually do it within the hospital, within the first few hours of life. So
Mhm.
yun yung first part of the screening. Meron na kaming algorithm for that has been set again. Yun. That's how early.
Mhm.
First few hours of life, pwede nang i-test yung ano. It's again, for the audience, it's non-invasive naman eh. What
Yes.
newborn hearing screening is, the first one is, we call it autoacoustic emission testing.
Mm.
Nung una nga, when I first heard about this, I was a student. I was thinking na hindi ba masasaktan yung baby because it's
Yeah.
autoacoustic emission testing. So parang medyo nakakatakot pakinggan, no? But what's
Yeah. It's
actually
loud
being,
sounds. Yeah.
'di ba?
Yeah.
So that was my perception initially. Baka masaktan yung babies or what's being done. So when I read about it eventually, and now being a specialist, it's actually recording lang yung frequencies that are being emitted by the normal human ears. So
Mhm.
there's special equipment to do that.
Mhm.
And once merong recording and sasabihin ng machine, we have these frequencies that are being emitted, that are being expected of a normal human being, a normal hearing ear, then sasabihin niya pass or fail.
All right.
Then
Doctor,
again, yeah.
okay. So in a sorry, didn't mean to cut you off, but in a newborn, I mean, to ask you that these normal emissions that you're talking about, or frequencies that a normal human being can hear,
Yeah.
what are the ideals? I mean, like, how do you define that? The normal frequencies, like in decibels, or like high or low sounds, and um maybe like the how loud it is. And actually, okay, who is qualified to conduct these tests? Because as you said, it can be done already in as early as the first few hours of life. So who's qualified to do the test, and what does it take to do the test in terms of equipment? Perhaps you can walk us through that step by step, so
So
that okay. So
there is a process of accreditation. Merong governing body in terms of who regulates which facilities are accredited. So it is being so meron talagang proper training on how to do it. Although it's not a very complicated procedure. You don't need specialists. It can be done by a nurse or a midwife. Uh, and there is a proper training. Merong governing body, the Universal Newborn Hearing Screening Center.
okay.
Uh, yeah. Again, this is everything is by law. Everything is written down,
Mhm.
and these testers, so-called, uh, and the centers are being accredited on a regular basis.
All right. Okay. So there's that body that's governing it, and it lays out the parameters, and you don't have to be a specialist. You don't need an ENT in the center, wherever, or wherever the birth took place. And they're the ones who tell you who can do it and what kind of training is needed. You said a nurse or a midwife could do it. So you don't need like audiologists or ENTs, or okay. So at least it breaks it down for a lot of our, a lot of the people, like, okay, it's not a very complicated thing. And then they say what sounds need to be
Yeah.
recorded
For
and
your,
all. Okay.
for your question earlier, it's a bit more complex, no? As we
Yeah.
hear sounds, I'll try to explain it as simple as possible. Meron tayong tinatawag na hair cells inside the ear,
Mhm.
no? We have the inner and the outer hair cells. It's microscopic. It can only be seen via the electron microscope. And ang purpose ng outer hair cells is to amplify the sound before reaching the inner hair cells. And yung frequencies being emitted, we wouldn't be able to appreciate it actually. It's the job of the machine. So
Yes.
hindi
Okay.
siya measured in decibels or ano. Uh, Yun. Tinitingnan yung response and yung frequencies emitted by those outer hair cells.
Mhm.
Uh, And
Okay.
yun nga, yung job ng outer hair cells na yun is to amplify the sound. And the job of the inner hair cells is to send that sound to the nerve going to the brain.
Mhm.
Yeah. So basically, the target of the screening is the normal function of the outer hair cells.
All right. Okay. And then, of course, the nerve going to the brain, and the brain will interpret the
Yes.
sound. Okay, whether the newborn can hear it properly or not. So how big is this piece of equipment? Is it easy to carry around?
Yes, it's very small.
Mhm.
Uh, how would I quantify it? Siguro, mm, mga apat na cellphone. It's a little bit bigger. Kung nakita mo yung mga mas sinaunang cellphone, it's as big as that.
Okay.
Mga
Okay.
na ano. So it's a little bigger than the modern phone.
Okay. Which model ng yung medyo malaki talaga na
Yeah, yung older phone. So but it's fairly ano talaga. So what's important is
portable.
yeah, ano siya, ano siya, portable.
Oo,
So,
madaling dalhin
so
sa
it's easy to be widespread,
Mhm.
or it's easy to bring to remote areas.
Okay,
Ang
yeah.
important talaga is yung training again and yung accreditation so that regulated and at least sure tayo that the screening is properly done in order to have that high accuracy
Yeah.
in terms of catching those who really have hearing loss. Yeah.
Mhm. And doctor, okay, with the 136 rule that you have when it comes to newborn hearing screening, what exactly are you trying to detect? If there's hearing loss, period, as in hindi nakakarinig yung baby, or may abnormalities lang, like mas mahina ang pangdinig niya, or malakas parang aso, ganun. Yung does it go to that extent, or does it just say pass or fail like you did, meaning nakakarinig pero hindi mo alam kung you're not sure, doesn't give you the exact range, or does it give grades in that sense, or just a pass or fail?
So the first part is the pass or fail, no?
Hmm?
And again, as pag na-screen na, so dadaan na ng specialist. So the
Mhm.
specialist and the audiologist will now request for more advanced tests.
Mhm.
This time, i-measure na yung degree of hearing loss if there is. So
Okay.
it can be measured.
All
You're
right.
right.
Hindi
So may
measure.
varying degrees ng hearing loss. Merong pwedeng mild lang, pwedeng moderate lang. It can be total loss of the hearing. But definitely, kailangan mag-intervene.
Kailangan
But
mag
you're right. We measure it. That's yun yung sa 3, yung
sa,
sa third month.
sa
Yeah.
third month. So sa first month, okay, pass or fail, and then by the third month, that's when you say na, okay, kailangan there's a definite diagnosis, like there's this much hearing loss, or medyo it's just off by a little bit, whatever that quantity is, whatever that standard of measurement is. And then in the 6th month, you can decide on how to intervene and what kind of interventions to use. And doctor, is hearing loss something that is, like, how common is it? And like, can it be temporary, or is it usually always permanent in a newborn? Like,
In a newborn, well,
like
it's since it's a genetic problem, kadalasan no, we have the non-syndromic hearing loss. That's the most common non-syndromic autosomal recessive hearing loss, meaning random.
random,
So,
no?
but it's more common. So, ang rate of hearing loss in newborns, it's 1 to 3 per
Mhm.
1,000 births.
What does
But
it-
if you look at the big picture, if you search yung statistics now, there
Yeah.
are 4,000 births almost per day sa Philippines. So
Yeah.
can you imagine,
Yeah.
meron at least 4 babies that are being born na with some degree of hearing loss.
Okay.
That's
Um,
the less kung one lang per 1,000. Paano kung 3? And if you're going to compute it whole year round,
mhm.
it's a total, I did the math a few days ago.
Thank you. Thank you. I could not do it right now. Or yes,
It's
please,
around
doctor.
1,460, or let's say 1,400 to 1,500 babies with hearing problems a year. And that's a lot.
That's a lot. That's quite a number.
Yeah.
And do you find, or in your field, and in your practice, do you find that it's grown in the last how many years, or that it's lessened? Is there a certain demographic of children or newborns that it's hitting? Um,
I
is,
think if you're going to look at the statistics, it may seem na it has grown. But the thing is, mas nasa-screen lang natin and mas
yeah.
nadidetect. Yeah.
Okay.
So it may seem that it has grown in number, yung mga patients with hearing loss.
Mhm.
But again, the thing is, mas mataas na yung awareness, and also mas mataas na yung screening and yung pag-monitor din of these patients.
So
I don't think is grown, the rate would have been the same.
So you think it's the same, that the rate has grown, but at the same time we're discovering it more because of these things, like, I mean, maybe yung mga hindi natin alam dati na may hearing loss na mas nalalaman natin ngayon dahil meron tayong newborn hearing screening na nagiging mas widespread, mas common. Pero sa tingin mo, malaki
It's
rin
still
yung
the same. No.
It's still the same, it's still the same.
Yeah.
Okay. Alright.
In terms of rate and yung kasi sporadic siya eh.
Oh,
Most of the
yeah.
hearing loss is genetic aberrations, either namamana, a small portion of it, but the bigger portion of it is really random, autosomal
know.
recessive na na random.
Okay. Well, sorry, not that we don't know. It's just a gene na we don't know when it will appear, but
Yeah.
it's genetic. Okay. So, and when we say that it's genetic, so meaning minamana, pero we don't know, walang bintangan yan na ikaw kasi ganyan. You know, in our culture especially, kasi your side of the family has this, your side of the family has that. Pero it could be another generations na walang nangyayari. Walang, okay, so ayan. So at least people have fewer fights. It happened.
It's a reality, no, that can really talagang common na question din.
Na sinong may kasalanan nito, like, you know, or it comes up because it's very difficult to deal with it or hear the news that your child has hearing loss or some kind of disorder. So you really can't blame one or the other. You wouldn't know. I mean, for parents, namamana, pero hindi mo alam kung kanino at kung kailan darating. Okay,
Meron
so
ding infectious causes, viral, a small portion of it. Tapos, if you're going to yung mas advanced na countries, they're doing antiviral therapy for these children. Ito yung medyo reversible pa. Although nasa experimental stages pa, but they have promising results. And again, ang mga mas recent na advances, if we're going to look at the first world countries in terms of, kasi yung pinaka recent, gene therapy.
Gene therapy, okay.
Yeah.
Right.
So they alter the genes of these patients, these children.
Okay.
Yep.
So doctor, we talk about gene therapy. Is there a way to detect if a child has hearing loss before the child is even born? I mean, because we're talking about genes and gene therapy here, or is it only something that we can now detect on a widespread level? I mean, scientifically, na okay, this child has hearing loss. Pag napanganak na yung bata, after the child is born and the child is tested, or is there a way that people have been able to tell that some children have hearing loss? How can that be done? How is it done, if at all?
Sige. So, just to clarify, hindi siya genetic testing. So, this is being done for patients who have undergone the existing na screening, na nalaman na may hearing loss because of the existing, kasi efficient yung system naman na in place. Tapos, these patients were being caught na, actually, one pa lang sa US, which has been published recently, a few months ago lang. And yung gene therapy is, they used it to treat the patient. Meaning they use the virus na vector. Medyo complicated yung na count but the simplest way to explain it is they use the virus to alter somehow the genetic makeup of the hair cells dun sa loob ng ear. Yeah.
They use the virus. Okay, so some of the hearing loss, let's go back to the point where you said some hearing loss, about 1%. Is that what you said? Can be some hearing loss in newborns, yung ibang pagkawala ng pandinig or hindi masyadong maayos yung pandinig sa mga bagong panganak, a virus can cause it. Yung parang nagkasakit yung bata, okay, na sa may tenga, naapektuhan yung
viral infection yung mommy and it has been passed.
Okay. Sa mga nakalusot sa umbilical cord or whatever.
Yeah.
Okay.
But for the gene therapy, it's medyo advanced lang. At gusto ko lang, it's a bit of trivia lang.
Sure, sure.
Medyo
It's good.
futuristic na at least we have something to look forward to
Yeah,
eventually in the future. Pero matagal pa yan.
matagal pa.
It'll take a few more decades for us to perfect
Yes.
technology, make it
When
completely 100% safe.
when it comes to the gene therapy, they also use a certain type of virus to change
There's
the not the makeup of the ear, but how the hair, just the
hair
hair,
cells.
just the way the hair cells grow, perhaps.
But
Yung may study ngayon.
yeah,
Oo.
they basically yung dysfunction dun sa hair cells, yun
Mhm.
yung ginagamit nila to change the genetic makeup and to make it functional again. Medyo
Okay.
complex siya eh. But
Complex.
for our audience at least, no,
Oo.
let's go back on track.
Yes.
At least yung existing na therapeutic interventions for here sa Philippines and all over the world, which is
Oo.
internationally accepted na safe and also yung standard practice. First one, kasi nabanggit natin kanina na pag-usapan natin yung treatment options kasi baka sabihin ng patients na wala nang pag-asa. There
Oo.
is. If your baby or child has been diagnosed with hearing loss, there are a lot of options. Huwag
Mhm.
mo wala ng pag-asa. First is hearing aids. Very
Mhm.
simple. Kinakabit lang sa tenga. You don't need any procedure or surgery.
Mhm.
Again, you just have to have them tested. Medyo tedious lang. Dadalhin niyo yung baby. Measure yung degree of hearing loss if there is. Then, iti-tailor fit yung hearing aid. Parang
Mhm.
glasses. I-adjust base do sa grado ng hearing ng baby. And at least, for some children, it's enough. Okay na
Mhm.
yon until they grow up, naka-hearing aid. For
Mhm.
some, yung total hearing loss, that's a bit more complicated. No?
Mhm.
Uh, we do cochlear implants.
Okay.
It's an implantable device. Isa siya sa mga first na implanted technology in the human body. Ang galing,
Mhm.
no?
Yes.
Uh, it has been existent for the past 60 years. Yung
Mhm.
first one was done in the late 1950s sa United States.
Mhm.
Uh, Ayun, it's being implanted. Tapos kinakabit na namin yung electrodes or yung special apparatus sa loob ng cochlea.
Okay,
And
so
these are the ones
mhm.
replacing the function of the problematic na organ,
Okay.
yung hair cells.
Doctor, when a child or anyone actually usually has hearing loss, is it usually more in one ear than the other or pantay?
Ah,
At saka pwedeng hearing loss sa dalawang tenga pero iba yung degrees. Can,
yeah.
yun na.
So, right. Very good question again. Merong unilateral.
Okay.
It would be a little bit more common.
Mhm.
And ito, uh, there are studies na yes, a child can grow na with hearing and develop normal speech with one hearing ear.
Mhm.
Yan. So ito medyo mula pwedeng mag-hearing aid.
Oo.
It's an option but if kunwari medyo pressed for finances and if they don't intervene pero iba pa rin yung both hearing
Mhm.
ears. So sa mga first world countries, they're pushing for binaural hearing. So even for one-sided na hearing, they would push for the implant or hearing
Yes.
aid.
Mhm.
And ang mas problematic, yung bilateral, which
Oh.
is a little bit less common.
Mhm.
Kasi total walang input eh.
Oo.
And how babies learn to speak is by mimicking. Kasi
Yeah.
kailangan ng stimulus eh. So if hindi nila naririnig, how would they be able to develop it, di ba?
Mhm.
So yun yung mas problematic.
Okay.
Uh, Yun yung definitely urgent na kailangan na ma-cochlear implant before they develop speech.
Mhm. So doctor, with using hearing aids, as you said, mas madali yun. It's as easy as ikabit lang yung device and you can put it on or put it in the ear or take it off any time. With the cochlear implant, you operate, no? You
Yes.
implant a device in the cochlea. Can you tell us where the cochlea is located exactly? And what that does? Does that, okay, so if you use a hearing aid, it amplifies the sounds. Parang it takes the place of, does a hearing aid amplify the sound like how the hair would? Or
Uh,
make it,
no. So we're
really?
talking about thresholds, no?
Okay.
Meaning, yung naririnig ng baby
Mm-hmm.
is, for example, yung hearing loss niya, or yung hearing level niya is not enough to hear the human speech. So,
Okay.
ang job ng hearing aid is to amplify the sound enough para ma-appreciate ng baby yung human speech.
Okay.
Para umabot sa level wherein it's understood by the brain. So yun
Mm-hmm.
yung job ng hearing aid. It's amplifying the sound.
Okay.
So it doesn't replace any function, but it
Mm-hmm.
amplifies. It's a compensatory device para lang umabot. Kasi hindi na naririnig ng baby yung yung normal speech level. So in order for that baby to hear the normal speech or kahit papaano, at least in close approximation of it, yun yung
Mm-hmm.
job ng hearing aid. Ang cochlear implant naman, it's a bit more complex. Merong external and internal device. What the internal device does is sinesend niya yung electrical impulse directly na to the nerve. So nire-replace na niya completely yung function ng hair cells. Yun what we discussed earlier. So
Yes.
electrical impulse na. So what it does is pinaprocess from the outside yung device, then it coordinates with or it transmits the signal to the internal device.
Mm-hmm.
Then it's converted into electrical signals sa
Mm-hmm.
loob ng cochlea. It's inside pa.
Oh, it's
Hindi
inside.
nakikita siya, yeah. If you've heard yung eardrum natin, it's a bit more medial or mas gitna pa.
Mas gitna pa.
It's surrounded by the hardest bone in the body.
Mm-hmm.
Yung petrous bone eh.
Mm-hmm.
Yun. Solid, very solid bone.
So
Yeah,
it's like rock.
yeah.
Solid.
Yeah. Kaya petrous bone. And temporal bone.
Mm-hmm.
And yun, nandun housed yung cochlea natin, which is the hearing apparatus, which is responsible for converting the electrochemical signals or mechanical to electrochemical signals to the brain para mapunta sa brain. So yun.
So those are the two different things na magagawa and what they do. And you were saying human speech. Kasi when we talk, doctor, di ba, parang, please correct me if I'm wrong. My understanding is that, it's an old understanding, is that when there is sound kasi there is movement. Like now I'm talking, I'm moving. So my vocal cords are making sounds. And since I've been, I guess, I'm part of this community and now we're speaking in English or pwede magtagalog tayo. Nagkakaintindihan tayo kasi the sounds that we make, the language, di ba?
Yeah.
Yun yung, okay, we understand each other, we're communicating. Pero maraming mga frequencies yan. There are higher notes in my voice or, parang when you hit something, you hear the combination of everything. Pero minsan may kulang, may di naririnig. Pwedeng yung hearing loss or the degree of hearing loss is you can't hear some sounds or some words kasi mas mataas pala sila and however that's calculated, which I don't, really know how. But, apparently some letters, when you say it, they're higher pala because of the position your lips and your tongue make. And then if it's a lower sound, sometimes naman, you can't hear the lower sound, so you have trouble guessing some words. And in an older person and an adult, when they experience hearing loss, or when like tayo, kahit let's say we can't hear each other that properly, kasi maano yung signal, medyo nababasa natin yung lips or out of context sa pinag-uusapan natin, like what we're talking about. I can guess more or less what you said. Diba? Pero syempre, when it comes to a child who's learning the language, mahirap yun. Kasi the context isn't there yet.
Yeah.
So it's not just like a matter of sound period.
Oh,
There's all of these little things that the hearing aids and cochlear implants take into place. Kasi I've also heard like just to dispel any notions of hindi, sigawan mo lang maririnig na yan. Kung na yung pandinig, di ba? You
yeah.
can hear, parang,
The stimulus, first of all, the stimulus needs to be consistent, no? For the child to be nurtured and for the brain to be stimulated properly. In terms of your question or query a while ago, yes, we do it. Kaya kailangan as much as possible, we measure the hearing loss accurately across frequencies. So it's frequency specific yung pag-tailor fit ng hearing aids, and also yung pag-adjust ng cochlear implant if the patient is adjusted. And in terms of, tama ka, yung speech is very complex. Kulang siguro yung isang oras for us, pati yung evolution of it, and also how the normal individual develops speech and how it processes speech in the brain. Mahabang usapan. So, but the basic principle of it is kailangan lahat ng frequencies. And if interesting, if any of the audience, if you would want to learn a little bit more, there is a graphical representation. If you search the speech banana,
speech
yung letters is spread across the different frequencies. If you search it sa Google, lalabas yung diagram ng speech banana, at what level, and also which frequency, kung ano yung specific for vowels, consonants, which letters. Yeah. Very interesting field.
Galing, very interesting.
Very interesting, yeah. Kulang yung isang oras.
Kulang.
And yun nga, years and years yung ibang tao, they develop their they invest, or they dedicate their whole life studying these things. Like for me,
Yes, like for you, I mean, it's,
and the other ENT professionals.
yes, and the people who are involved in research and all of, for all of these things. The doctor, can hearing loss be temporary at any stage, especially in newborns, since we're talking about newborns? Like you there's some hearing loss. Can it be temporary, or is it usually always permanent? I don't think I was able to quite get like ask that definitively and get a definitive answer earlier.
Yeah. So unfortunately for genetic, kasi there's something wrong, no, when yung during the development, if it's a genetic problem, yung kalalabasan na organ is really deficient, or there's a problem. Usually for these genetic problems, permanent siya, unfortunately. Tapos yung viral, that's yung sinabi ko kanina na what's being studied. Initially, it was thought to be talagang permanent, but yun nga, mayroong mga treatment modalities nowadays, but it's done in first world countries.
Baka isang araw, isang araw aabot din doon. Like
definitely magiging worldwide. Like yung hearing test and yung technologies like hearing aid, cochlear implant, it took some time for it to be widespread, but things will get there. No.
Thank you, doctor. I mean, so it's often, as you said, if there's hearing loss already, and no matter what degree it is, whether you say 30 degrees in this in this perspective, or let's just simplify, let's say 50%, 70%, or 100%, 90%, is it usually a structural defect? It manifests in a structural defect in the anatomy? Because
Hindi siya nakikita in the CT scan or MRI, if that's your question, kadalasan. But there are some anomalies. So marami yan eh. It's really a spectrum. So there is a lot of genetic abnormalities, and also yung manifestations in terms of structural changes. So hindi lahat nakikita sa CT and MRI. There are some patients wherein pag in-scan namin, there is a structural abnormality. But
Mhm.
kadalasan yan, it's really just functional. Meaning sa microscopic level or
Oo, dun na
molecular
lang.
level yung problem. Yeah.
Okay.
And the thing is, uh, I failed to mention na
Yes.
kadalasan, so the hearing losses, hindi na pwedeng mag-improve unfortunately for almost all. Ang sad part is pwedeng mag-deteriorate. That's why
Okay.
it's important for once your child or baby gets screened for a certain degree of hearing loss, kailangan talaga ng regular monitoring kasi pwede mag-deteriorate.
Okay, so even if, okay, that's the unfortunate part, pero pwede mag-deteriorate as in terms of screening. So hindi lang once, ibig sabihin doctor, magfa-follow up yan as your child is growing, especially if you detect it in a newborn. Siyempre, the doctor will give you a schedule na bumalik ka ng ganitong ano. And what are some of the signs? Oh, let's say you didn't get to do it or for some reason it wasn't detected, no? What are some signs that parents can look out for that there's hearing loss? It may not be total, baka 50% lang, baka 30%. What are some of the signs that parents can look out for na parang ano, my child might have hearing loss? Ano yung mga ibang ano doon?
Uh, f- First, gusto ko muna linawin, no, yung, kasi baka matakot yung mga parents who are
Oo.
listening audience, yung one fail dun sa autoacoustic emission doesn't automatically mean na merong hearing loss talaga, ha. Kasi baka matakot yung ano.
Oo.
There is an algorithm or a pathway that we follow. So it's uulitin pa yan. Pag nag-fail ulit, pag nag-pass, di okay. Pag
Okay.
nag-fail the second time, re-refer sa specialist, we do a more extensive testing to determine if there is hearing loss, true hearing loss. If there's none, pwede pa rin, no? Pwede pa rin. Tapos, kung meron yun, that's the time na medyo mag-worry ng konti, but there are a lot of options. And for your question, so balik lang ako on track to your question.
Sure.
For those, for example, very, very rare conditions na okay sa screening, but there is hearing loss. Ano yun? It can happen. Napapansin nung parents, usually pag may loud sound, hindi nagre-react. Kasi there is a moro, we call it the moro reflex. Magugulat yung baby pag may
Yeah.
loud sound. So mapapansin ng mga parents, parang hindi nagre-react.
Yeah.
And the second thing is, parang delayed. Hindi pa nagmamamapapa yung baby by the age of 10, 12, or 16, 18 months. Yan. So we call it the milestones. So by this age, so at least by age, if I remember correctly, nagsa-start magbabol yung mama and papa. It should start at around 8 to 10 months. And ang red flag niyan, pag umabot ng mga 18 months, as wala pang kahit anong speech, a little bit earlier.
So you could take your
Sign.
child. Oo. Those are signs. Pero also again, like I know you don't want to scare or panic the people. That doesn't mean, but you could have it checked already. Para kung sakali, if by chance the child has hearing loss or is in a slow developmental stage because of a hearing problem, then it can be addressed already. Yeah, I know this kid, she would hardly talk, but just amazingly, she was 3 years old, she would have like full, that wasn't me, and it's really, I know this kid, she had like full conversations with instructions and, so it doesn't always mean that she would rarely talk, but then there's also a case of that I know, like they thought the kid was just quiet, but as you said, some signs are it's a reflex, no, yung nagugulat, like there's a loud sound, may pumutok na ano dyan sa kuryente. Like
Natulog pa rin, no? Oo,
yeah, and everybody wakes up, or anyone can get startled by a loud sound, and then but it doesn't seem to bother, or there's a slow reaction that the child has to it, or they're not babbling or making sounds. That could be a sign, and you can take your child to get tested just to be sure. And the thing here is, the earlier you do it, the better it is for your child. No, doc, we're trying to encourage people to get it, to get the testing and to address it quickly.
Yeah, that's the whole point and the whole objective of the law and yung advocacy natin of all of
Yes.
you for the patients to feel the security, and also yung that there is hope, and that
Yes.
there are people to help these patients.
Yes. For example, people like yourself, Dr. Lapina, and your colleagues, and the whole association or the regulating body, even the proponents of the law, a lot of people listened, and they did this. And there are those who also, people who can hear, but like I've met people who, who have been proponents of sign language for those who cannot hear, or some people just choose to, use sign language and speech. Maybe their parents cannot hear.
Yeah.
It's not always just the child. It's something that you could learn for your parents, or a family member, or just friends, no? Who you might want to reach out and learn, and then learn all about these things. And I hope that I know you're a very inspiring person, that you inspire more people through this platform to join your advocacy, because it's really a good thing. There's so many things you can advocate for, and this is one of them. I'm told that we're running out of time, doctor. Is there anything else that you'd like to say? You can have a couple of minutes to say whatever you'd like, or to remind us about the testing. Anything you'd like to say, technical, or any kind of information. You're always interesting to talk to.
Yeah, thank you again. Thank you very much, Nicole, for having me, and for the very good conversation, interesting uh, conversation topics, and and again, thank you for helping us spreading the word, and again, making these advocacies out there be heard. And for the audience, those nandito lang ang iyong mga friendly specialists from Makati Med, and doctors. Everyone is very much friendly and professional, and don't be anxious to seek consult if there is some degree of suspicion or worry or anxiety. Yun lang.
Thank you, doctor. And on a good note, that regarding this topic, but not for an infant, I know somebody who's getting the final fitting for her hearing aid soon, and that is a good thing. And
Yeah.
when they say, people won't like that. No, actually, she liked it, because she could hear more again. She could hear again better, and could hear better again, and be part of the conversation. So yan,
Yeah, I'm glad to hear about your
yeah.
friend's journey.
Yeah. Yes, I could tell you about her journey, but today is for you and your advocacy, and for the hard facts, the statistics and the newborns. This person is a bit older, but as you say here, hearing loss occurs, and we often talk about it in the elderly, but it's a good thing. So people, whenever Dr. Lapina comes out, please do listen to him, and come back on the show more often to talk about so many other things and ways to take care of our ears. We take it for granted. And thank you to those who listen nga pala to the show on traditional radio, like Veron. Hi, Veron, if you're listening again today. Thank you to you, and Lita Ramos, if you're listening. Okay, thank you, doctor. Is there anyone you'd like to say bye to before we wrap up?
Ang aking ENT family in Makati Med, and the center, and everyone, of course. Makati Med and my family. Yun lang.
Thank you. Okay, thank you, doctor, for being on the show. Very inspiring. Thank you, folks, for tuning in. And we'll see you on the show next week. Healthline with Makati Med. Don't forget, Mondays, 5 to 6 p.m. Bye, everybody. See you next time.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.